I'm Dr. Amanda. I'm an orthodontist and CEO of StraightSmile Solutions. We help dentists understand orthodontics better. This video will share an excerpt from a webinar hosted by Clue Dental Marketing and Dr. Lanes of Modern Essence Dentistry. Any patient photos are the property of Modern Essence Dentistry. If you have questions, please reach out at www.cluedentalmarketing.com. If you have questions about orthodontics, please visit StraightSmile Solutions at www.straightsmilesolutions.com. Enjoy the video.
So what is the why? Why are we here today? Why should you do ortho if you're a primary care dentist, be it a, GP or a pediatric dentist? Well, I'm not out here to destroy orthodontics as a profession. By all means, I'm not, because actually a lot of doctors that I coach or I work with end up sending more cases than ever as a referral to ortho. It's really important, though, that you understand the basics of orthodontics so that you can explain the why and explain the referral. Whether you're going to treat the patient in-house or you're going to refer them out, you still should understand orthodontics and basic airway. And in 2017, the ADA issued a referendum talking about how airway is something that we need to be talking about in our practices. So orthodontics is directly related to airway. So that's why I would love to teach you guys a little bit more about what I know. And if there's anything that I talk about today that you want to know more about, I will give you my email again at the end, and you're welcome to shoot an email out to me. And I've got literally so much content created. I just love creating content. I guess maybe I'm not a millennial, but it might be like a Gen Z millennial thing. I just enjoy creating content and posting it. So I have over 3,000 to 4,000 YouTube videos, how-to videos, and blogs on pretty much everything out there. And every single day, almost, I add to it. So just tell me what you want to know. Like, I want to know about it, more about an RPE, and I will send you the information that I have. That's totally free of cost. It's a free service. So the more ortho that you do, and also the better your GP work is going to be. So even if you're not interested in ortho at all, sometimes it's nice to learn a little bit about ortho, because you might want to line those teeth up so you can place an implant. Or you might want to line those teeth up so that you can place better veneers without having collisions and having them pop off, right? What's going to happen if you try to do, veneers on these teeth? That's not going to work, right? So we got to fix it. So that's the why behind it. So it can bring a ton of revenue into your practice, not only the ortho itself, but also the GP work that you're doing. So I think that there's definite why behind it. Now, there's three major pain points that I often see when I talk to doctors, and I'm more than happy to talk to any of you. It's totally free of cost if you want to just chit chat, about ortho in general, or maybe your place in it. But there's three major push points that I often get, and I just want to go over them and kind of, give you some suggestions. So the first one is people think they have to take an actual class, which you totally do not. There's so many complimentary resources out there, and I'm super glad to send you the ones I have or direct you to places that I know that have them. In addition, you really don't have to have any equipment, especially if you're doing phase 1 interceptive or aligners. There's no equipment that's needed. Having a scanner is nice. It's a want, and it will benefit you. It'll definitely make things easier, more efficient, but it's not a requirement. So, but that would be the only thing I would say if you were going to invest in something. And most of you probably have one anyways, and it can work around whatever scanner that you have. The number two would be upsetting the status quo referral pattern. And I know a lot of you have, I call this, my friend. So you might have a friend down the street who's an ortho, or a friend from school who is an ortho, and you don't want to piss them off. And I get that. So don't get me wrong, I get that. But the more you learn about ortho, the more you can qualify that referral, whether it's a referral in-house or it's a referral out. If you understand it and start screening people earlier, you're going to be really doing your patients a service, not only giving them nicer, straighter, healthier teeth and gums, but you're also going to be screening for airways and reducing the likelihood of needing extractions or jaw surgeries later by starting really, really early, even on kiddos as young as 2, knowing what's going on, advising parents to get prepared and what type of intervention is necessary, and fixing oral habits as needed. So I can guarantee you, if you get started, you're not going to actually piss off your local orthodontist. You're actually going to make them happy, as well as doing great service to your patients and your community. The third push point would be inefficiency and margins. And this is the one I see most doctors at. They're kind of doing it, but they're dibbling and dabbling in it, and it's not very efficient. And they feel like they're not making any money off of it. And they feel like they're spinning their wheels, and it's hard to balance in a GP practice. And it is, don't get me wrong, it can be hard to balance. Like I said, my husband is a general dentist. So I get a lot of my suggestions from him. He's been doing ortho for, goodness, 15, 12 years, something like that. He loves it. And his reason, he's a little older than me. We were classmates in dental school at UCSF. But he's like, dude, this crown and bridge work is, it's getting old. He says, it's hurting. He might be on the on the presentation. So hi, if you're there. But it's getting old. It's tiring on my body. I want to, as I get older and in my career, I don't want to be breaking my back, and hurting myself. I want to do things that are easier and more profitable and better on my body. And later I can get an associate to do the bread and butter work, So, and the cool thing about ortho is the vast majority of the work that you can do can be done, depending on what state you're in, but can be done by your team. So yeah, you're the brains behind ortho. Ortho is like a big puzzle. All you're doing is doing the puzzle. The hardest part, which is the best part, is doing the puzzle, figuring out how you're going to do things. It's a long-term puzzle. And then from there, you just delegate. So, especially if you're doing aligners or phase one, there's really no reason you have to be doing any of it because you're doing the treatment plan ahead of time, right? In most states, the staff can place the attachments. Yes, you're going to have to drill the attachments off at the end, but it probably takes you 3 minutes to drill them off. So this is all staff chair time, and it can be totally run by the staff too. If you're doing braces, depending on where you are, some states you're going to have to place them. But if you're doing indirect bonding, and we're going to talk about that, then you're virtually placing them and approving the placement ahead of time. So that's a workaround. And even a lot of orthos do indirect bonding. Let the computer place them so I don't have to stand on my head, and that way I can approve the bracket placement ahead of time outside office hours. And then my team can go ahead and deliver them. And I'll just verify it before they leave, make sure, it's on correctly. But again, most of that can be done by teams. So pretty cool. And yes, you're gonna have to take the braces off, but that takes like 5 minutes. So getting more into the nitty gritty of everything, we're gonna be talking about 3 major types of appliances today, as well as retention and hybrid, which is kind of a mixture of a few of these. But we're gonna be talking, I'm sure a lot of you know about aligners, right? We're gonna talk about that. Then we're gonna go into phase one appliances, which is your interceptive, airway, growth modification, habit appliances. So that's gonna be kids usually 9 and under. And then we're gonna talk about braces. So I really strongly recommend that if you're gonna do ortho, do it, and that's gonna be the cool thing about Dr. Giannis is that he does all kinds of ortho. He doesn't just do Invisalign. He doesn't just do clear correct. He does it all. Matter of fact, he'll tell us, but I think the only ortho he doesn't do, he definitely refers out when he doesn't feel comfortable with the case, but he hands out doesn't do any jaw surgery cases. And I totally support that. I don't think general dentists should be doing jaw surgery cases. I don't even like to do jaw surgery cases. So as a matter of fact, a lot of offices I worked at, we just weren't equipped for it, with the staff and the hours. So I used to refer them out to other orthos. I've done them, but it's just not profitable. So, but yeah, you should do it all because why? First of all, by doing phase one, you're basically feeding your phase two practice. You get 2 cases for 1 referral, right? Or from 1 patient. And often if you do phase one, which is so easy and fun, you often get the siblings, the parents, the cousins. It's a no-brainer and it's so easy and it's 100% can be done for the most part, unless you're doing fixed, can be done by the team, with your supervision and, direct supervision in most states. Braces are going to take a little bit more, we'll talk about that, a little more technique sensitive. You do need to actually learn some skills. Often you might have a team member who's already experienced in them. I hesitate to have you start braces if you only have the team member though, because if your team member leaves and you've got all these braces cases, sure, we can tell you how to do stuff, but there's a huge learning curve and even my fingers are not fast anymore. If you tell me to do this, do that, I know how to do it, but I'm a heck of a lot slower than a skilled assistant at this point because I just don't do it very often. It was pretty fast in residency because we didn't have assistants, but I recommend that the doctor knows how to do it too, because it's going to happen, assistant is sick or something like that.